So patients and their families are always asking me, and this is something I think about a lot, and I really wanted to share my 5 keys for spine fusion success. Choosing to have a spine surgery is a huge decision, and it's a really, really complicated process and can be challenging. So what are 5 things that you as a patient or as a family member can do to try and make sure that you get success if you have had a recommendation for a spine fusion? Now, the first and foremost, number one, get the right diagnosis. It is really, really important to make sure we know why we're doing surgery and what structure in the spine needs surgery. There are all these different bones, joints, discs, nerves, all these things going on, and any one of them or a combo can be the cause of someone's problem. And so it's really, really important in this complicated circuit board to make sure we're addressing the right spots. And one of the most common reasons I see for someone to not get the result they want from surgery is really they didn't make the right decision. So we've got to get the right diagnosis for the surgery. We have to choose the right levels and make sure we're operating on the right spot. There are many patients who have 3, 4, 5 bad discs in their spine. And most of those patients, if they do need surgery, don't need surgery at every one. So you really want to ask your surgeon, if we're doing surgery, where are we doing surgery? And why are we, if there are other spots that have trouble, ask to see your imaging. Why are we doing this one and not that one? How are we making that choice? And for a surgeon to make the right recommendation, we talk to patients, we can figure out a lot by playing detective. But we can look at patients' imaging, x-rays, MRI, we can examine patients, and we can even use specialized tests, nerve tests, injecting one area versus another to see which one makes the pain go away, all to hone in and make sure we're doing the right surgery. And that can be a little time consuming. It can be frustrating for the patient and the surgeon, but you really want to do everything you can to choose the right surgery the first time around. And so I like the old adage, like measure twice, cut once. Try and make sure you're having the right surgery the first time around. Now, my second would be, okay, we know exactly what levels and what structures we need to treat. We need to choose the safest surgical technique. When it comes to doing a surgical fusion, there are many different ways to do a fusion. Fusion simply means you're welding 2 bones together. That can be done with metal implants or without medical implants. And it can be done from the front of the spine, the side of the spine, the back of the spine, a combination. And each of these different techniques has a different type of incision, different levels of muscle dissection. They have different levels of how invasive they are. Really importantly, they can also have different levels of how much nerves need to be moved around during the surgery. And the nerves in the spine are very, very delicate. So I'm always really cautious with surgeries that require for you to move a nerve out of the way to do your work, because that can really cause some irritation just from the surgical approach. We want to make sure we're doing the right procedure for the right patient. And that's my number 2. Now, number 3 can be a little bit of a hard one. I think we really chalk it up to a surgeon's level of accuracy and delicacy. And that can be hard to ask a surgeon. If you find a surgeon who says they're not delicate, then I know you should run for the hills. When it comes to accuracy, many spine fusions we're placing implants, and we have to put these in very precise locations. We have to hit a bullseye every time. Now, a lot of us have published our accuracy of our surgeries, and so you can actually read the things that we've published in the medical literature. I think that's a great way to go. Certainly not all surgeons are doing things at that level, especially those of us who are using specialized technology, things like robotics and augmented reality and computerized planning. We can use these things to make our surgeries more accurate and therefore more safe, and really understanding your particular surgeon. What techniques do they use? What is their accuracy? Now, determining if a surgeon takes their time and delicate in the OR is a really, really challenging thing to do. I think really the best way to judge that is your surgeon seem like they're taking their time and being delicate with you and planning and explaining things? Do you feel like they're going to come into your surgery really well thought out? And another great way to judge is, if the surgeon has a lot of patients out there who are doing great, have had surgery and gotten back to the things they love, I think that's a really, really great sign over the course of a surgeon's career, if actually in the operating room, if they're really doing a good job for people. That's certainly probably the hardest one to judge out of my top 5, but surgeon delicacy. Now, if we look at spine fusions, we're welding 2 bones together, and the spine is meant to move. So when we weld 2 bones together, we fix it in that position forever. Many fusions do not do a good enough job of realigning the spine properly. They fuse the spine in a bad position. And the concern is if you fuse the spine in a bad position, then you can increase the rate of degeneration of the rest of the spine. Some studies show even over 10 times faster rates of degeneration. And so when we look at a surgery that's done to put a cage in from the front versus the back, uh, anterior lumbar fusion, or what we call TLIF, those have different rates of being able to realign the spine. And that's not just related to how good one surgeon is versus another. Those are just inherent to the technique. So making sure that your surgeon is thinking about your spinal alignment and choosing the surgery that's going to put you in the best position is critical for your long-term success. And then finally, when we put these implants in, cages, screws, rods, it takes time for the bones to heal together. And if the bones don't mend together properly, things can get loose, and down the road you don't do well, right? So a failed fusion, or what we call a pseudarthrosis, that's something where months down the road someone can do very, very poorly. Now, in terms of getting a fusion to heal properly, it is a little bit back to the surgeon accuracy and delicacy, but it's also about which type of implants, what type of bone graft are we using, and you really want to understand from your surgeon, what are my chances of getting this fusion to heal properly? What are the things that we're doing? And what are the things I need to do as a patient as I'm recovering? A lot of my patients who are having fusion, there's some time where I don't want them maybe bending, lifting, twisting. We may need to avoid certain types of activities while we wait for the spine to fuse. And I do see a lot of patients where kind of 2 weeks and the surgeon says, off you go. And they don't know that they really need to be careful for months. And if you start doing too much before the super glue has dried, right, before the spine fusion has healed properly, you can get into trouble. And so I know that's a lot. I know it's complicated. I'm sorry, but it is complicated. And so again, for me, the 5 keys to spine fusion for success: get the right diagnosis, choose the right procedure for the right patient, which of the surgical techniques is best, really understand your own surgeon's level of delicacy and accuracy. Ask them about your spine alignment and make sure they're thinking about that and can talk to you about it. And finally, talk to them about the success of the fusion healing and things they're doing specifically to make sure that this goes properly for you.